I'm going to press record and welcome everyone to the May 27th Sacramento County Public Health Media Briefing. As a reminder, we will do a quick briefing from our public health staff, and then we will give you the opportunity to ask questions. Please stay on mute until the question and answer period. And I will go ahead and throw it over to Dr. Olivia Exterior.
Good morning, everyone, and thank you for joining us again. So I'll start with a brief update of our numbers. And this is as of yesterday morning, we had 106,043 cases of COVID-19 reported to Sacramento County and 1,702 deaths. Our daily case rate, our daily numbers now, we're averaging about 75 new cases per day, and the daily case rate has dropped to 4.9 per 100,000. According to the blueprint that was updated yesterday, the case rate is at 5.5 per 100,000. So that meant that we met the criteria for the orange tier. We do have to meet the criteria for 2 consecutive weeks. So our expectation is if we continue trending the way we're trending right now, we will be in the orange tier on Tuesday. The importance of that, of course, is that with the orange tier, it's less restrictive, so increased capacity for businesses. And also at this time when a lot of schools are in the graduation, this will be good news for them because they will be able to increase their capacity for their graduation events as well. We have had several questions being asked about missed second doses. So I'm going to turn it over to Stacy Kennedy to talk a little bit about what we're doing to address that issue.
Good morning. So for people that have missed their second dose, we're still encouraging them to go ahead and get a second dose, no matter how long it's been. They will not have to restart the vaccine series. And it's really important that they get both doses for optimal vaccine effectiveness. So for someone that needs a second dose, 211 is probably the easiest way to find one. They can help them navigate through different sites that might offer Pfizer or Moderna. Our Cal Expo site has Pfizer, and they will always take people for second doses. In Cal Expo, you can just walk up. You don't have to have an appointment, or you can go to My Turn to get an appointment. Safeway is another really good resource. Safeway usually has Pfizer and Moderna, and they're now taking walk-ins. So someone can usually find a Safeway in their neighborhood. And then any of our mobile clinics or pop-ups, they'll take walk-ins and they will get a second dose as well. The most important thing for people to remember is that they should bring their vaccine card with them. That way the clinic can confirm what vaccine they need and that they need a second dose appointment. And I'll send it over to Rachel.
Hi, good morning. So normally this is when I tell you the exact number of vaccines that we are receiving for the following week, but this week there's a first. We actually did not receive a pre-allocation of vaccine. So with the decreased demand over the last couple of weeks for appointments, the state recognized that most counties had an excess supply. And so in order to really exhaust the doses that we already have in storage units and also to minimize wastage, they asked that we instead try to redistribute within our own county. And also we can, we can cross county lines as well. So no counties, to my understanding, were pre-allocated vaccine, but we certainly had the option if we felt like we needed vaccine to order. So we work closely with our providers and have a good assessment of who needs vaccine and who has excess vaccine already. So we've already been redistributing with our providers within Sacramento County, and based on our assessment of our needs, we did not put an order in for any additional vaccine. So our providers know that if they have excess vaccine, if they need vaccine, regardless of the type, that they can reach out to my office and that we will arrange transport and get them what they need or pick up the doses and move them to someone that can utilize them. So and I think going forward in the weeks to come, the state will move to a process where providers can simply just order vaccine. So it's going to be simplified now that we know we have enough vaccine to meet the demand. And then I want to go into a little more detail about something we hinted at last week, which is that we're really looking to do some fun and exciting events with community partners, and really in keeping with the strategy that we know is working, which is to really get the vaccine out to where people are, to bring it out to the community, to make it convenient. We're excited that this week we're working with a couple of really fantastic partners. The Sacramento Republic FC is hosting a special pregame clinic this Saturday, and then at a couple of other games coming up this next week. And they're doing that in partnership with Equivax and Dr. Oshida from Urgent Care Now. And so I'm sure you've seen it already advertised, but it's an easy, convenient, and I think fun way to get vaccinated. There's going to be a pre-clinic right before the game. And if you register for an appointment at that clinic, you get free admission into the game. So the free admission is for the patient only. And so the link to that, to register for that, went live on our website this morning and will hopefully be on My Turn later today as well. And then I'm going to turn it back over to Dr. Kasiriye.
So with that, also, as Rachel mentioned, we are making a push to find more innovative ways of getting the vaccine out. And so reaching out to businesses that are willing to offer incentives to reach out to us so that we can work together and make vaccinations more available. We are going to be working with the Sacramento Republic FC throughout the summer and planning different events where we can actually take vaccine into the different communities, especially those that are underserved that right now are trailing in their vaccination rates. So again, putting the call out, one, for people to make themselves available for this opportunity that we have with the Republic to actually be able to get vaccinated and get a free ticket to a game. And then also for other businesses that would like to do something similar to offer an incentive, that we would be very grateful to be able to work with them and offer the vaccine at either their sites or other events. So with that, I'll turn it back to Jana.
Thank you very much. Okay, so that is the end of our briefing. We will go ahead and open it up to questions from the media. You can either utilize the raise your hand feature or drop a comment in the chat. And I will start with Felicia.
Good morning. So I know a couple Bay Area counties have said they're considering keeping some local restrictions past June 15th. Is this something we might see in Sacramento County too?
Our plan and what we've done throughout is we've been following very closely what the guidelines are from the state. And so that's the plan for us for June 15th.
Got it. Thanks.
Chelsea, go ahead.
Hi, Chelsea from ABC 10. I remember in previous weeks, it was mentioned that there was outreach done to some of those 65 plus who missed the vaccine, their second dose. Please let me know if I'm wrong. And I was just wondering how that went, how that outreach went, if there's an update.
Yeah, thanks, Chelsea. So we're actually preparing to do that. Our team has started doing that this week. So we've created kind of separate line lists of those groupings and are working with our provider partners to do it for the ones that so if a provider provided the first dose, we're asking them to personally reach out. And then our team and volunteers are doing the outreach to anybody who has not. But we've also are collecting information from the providers on kind of any changes that they've had in their workflow process. And we're providing that feedback to the state as well if there's any changes with database systems that have changed their outreach process to miss second doses. So I don't have a whole lot in terms of the outcome of how many have been successful since we just started it this week.
I don't currently see any other hands raised. Give you guys one last call for questions. Otherwise, as usual, we will send out this recording. Okay, Chelsea, you have a follow-up question?
Just a request for if there's any updated data on the missed doses. That's all.
As far as how many people have missed
Yeah.
classes and in what increments? Okay. I'll make
That
it.
would be great. Thank you.
Or how many we've scheduled, is that, or linked or reached out to, is that?
Any and all information would be great. I'm not going to be choosy.
Okay, we'll add that to the list of things to send out in the recap, as well as the full recording. And as a reminder for the Republic FC clinic, that can be found on our website and will be on My Turn later today. And I'll include that information in the follow-up email as well. So we will go ahead and end this, and I'll send out the recap email shortly. Thank you for coming to the Sacramento County Public Health Briefing for May 27th.